Let's talk about scope of practice. For decades, pastors have been encouraged to refer to clinicians any congregant that comes to them presenting signs of mental illness, because mental health is outside a pastor's scope of practice. Now, if, and that is a big if, we accept a biomedical model of mental health, then yes, it is outside of a pastor's scope of practice to treat any symptoms of any illness. However, mental health is a little bit more complicated than that, and over time, we'll be unpacking just that. But for now, let's just accept the biomedical model and explore scope of practice. Every profession has a scope of practice. A scope of practice is the boundary line around what types of issues a professional can address. For instance, an EMS worker and a trauma surgeon will treat the same patient, but what kind of procedures each of them can do are vastly different. The same is true for a nurse and a nurse practitioner, for a paralegal and for an attorney. Scope of practice is what differentiates the type of help that a professional can give. Scope of practice comes down to the question, how can I help? Scope of practice is a legal principle enshrined in federal and state occupational codes. These codes limit what a person can do in terms of activities that are reserved for professionals. For instance, it is illegal to practice law or medicine without a license. In this legal sense, it absolutely is within a pastor's scope of practice to provide counseling to a congregant. However, scope of practice is also an ethical principle. It is not ethical for someone who is not trained to assess, identify, and treat a mental health condition to try to do so, because bad help harms. Yet, when we talk about making a referral, which is an activity that connects individuals to needed mental health care resources and supports, we imply that one should make an assessment that none of us at church are qualified to make. So, please recall our video about person-centeredness. Just in a nutshell, person-centeredness assumes that an individual is able to self-determine a meaningful life and make treatment decisions for themselves. It honors the choice and the voice of the individual above all. Here at Christ Church, unless you are a counselor in the Hope Counseling Center, in a session with someone who is your client, you are not qualified within your scope of practice to assess whether or not someone is experiencing a mental illness. Here's the problem. We all default to assessment when we feel that someone needs our help. We have a false belief that unless I can identify what's wrong, I can't help. But that's not true. It is not within your scope of practice to ask Dr. Google or give an armchair diagnosis or insist that you know just the right person to refer someone to. It is within your scope of practice to ask open-ended, person-centered questions about what the other person feels, what they believe, what they want, what their goals are, and what type of support or clinician they feel would be best for them, even if that clinician is not a psychiatrist or a therapist. So let's recap. Bad help harms. Scope of practice is a legal and ethical principle that puts boundary lines around what a person can and cannot do to help someone else. Only a licensed professional in the bounds of a clinician-client relationship is qualified to assess, identify, and treat signs of mental ill health. In church, we use person-centeredness to ensure that we are operating within our scope of practice when we make a referral. We ask open-ended questions that center an individual's own feelings, beliefs, and desires so that we can make a referral that is within our scope of practice and hopefully appreciated. If you missed it, check out our previous video, Mental Health Words to Know, Person-Centeredness. Don't forget to put your questions in the comments below. And if you'd like to share your experiences, be sure to protect your own privacy. If the content in this video has brought up uncomfortable emotions for you, please contact one of our counselors in the Hope Counseling Center. The number is on the screen. There are also additional resources for you and those that you love in the description box below.